Thank you, everyone. We're really excited that you could attend our first ARVR lecture in a series. My name is Eleni Balasal, and I am the founder and co-director of the ARVR Lab, and it's sponsored by Strategic Communications. Our mission is to educate on the applications of virtual and augmented reality and to serve as an incubator for related advances in patient care, medical education, and research. By engaging the radiology department and the larger enterprise, we aim to lead the development of AR and VR innovation across MGB. A bit of housekeeping, we have closed the chat box. Please use the Q&A function for any questions that you may have. Our list of panelists will answer accordingly. We will have a Q&A at the end of our presentation as well. Today, we will introduce the lab's advisory boards and directors. We will hear from staff invested in the advancement of mixed reality in medicine. Our first look at AR/VR in medicine is presented by Dr. Raul Uppot, a founder and co-clinical director of the MGH ARVR Lab. He is an assistant professor at Harvard Medical School and an interventional radiologist at MGH. Dr. Uppot has been developing and implementing AR/VR tools for radiology education and training, communication, and clinical care. He has published and presented on this topic at national and international conferences. So I will stop sharing, and Dr. Uppot, please take it away.
Thank you very much, Eleni. It's great to be here. It's great to see all the panelists here with me, a great group of people. Let me start my talk here. So as Eleni said, if you want to mark your attendance, please type that information that you see on the slide, and then you will get credit for this talk. So I'm going to talk to you today about implementing VR and AR tools for training and clinical care. These are my disclosures. So my objectives for today are, number one, to define VR and AR, a very short slide. Most of my talk will be on applications of VR and AR for training and then clinical care. We'll talk to you guys about our exciting new AR and VR lab and the panelists that we have with us. And then we'll have a panel discussion of what we're doing here at MGH. So what is virtual and augmented reality? So when you look at it, this is from a Wikipedia slide, you know, if you look at, there's essentially a continuum. On the left, here is the real environment that we all live in right now. But it turns out that over time, technology has allowed us to now augment that reality. So there's augmented reality whereby by wearing glasses, you can augment what's in front of you. You can add things to the current environment. Then there's augmented virtuality where the entire environment can be virtual, but you can augment that with reality. And then there's just virtual reality, where just the entire environment is purely virtual. So that's the pure definition of it. It has been used for many applications outside of medicine, but my goal today is to focus on its use in medicine and radiology. So why can we use it in radiology? You know, the exciting thing about radiology is that we're based on digital information. Everything that we do is based on digital stuff. So the ability to take that information and add it to a virtual environment becomes much easier, and it's quite possible. So myself and a few other individuals, Colin McCarthy and guys at the UCSF, were very interested in this. And back in 2019, we published a paper on our exploration of this technology for radiology and medicine. And we were excited. We thought we were on top of the world. But it turns out that this technology has existed for many years. So 25 years ago, people at our own institution and in my own division, Dr. Dawson had been working on simulators, virtual simulators that can help in training. And this was published back in February of 1996. And these are, again, early papers where people always realized the potential of being able to use computers and catheters and wires and combine them and create simulators based on these technologies. We went on to do our first actual publication where we actually studied this, and Colin published this in terms of using recording a bunch of procedures and then displaying it to trainees and seeing how this works for them. So this is Colin, and this is what we did. Our first grant allowed us to buy these cameras that we could put on our headsets. We can then record the procedures in stereoscopic views. We had cameras that could allow us to record this in 360. And then we could display them like this. So students, trainees could wear stereoscopic viewers. They can view things in stereoscopic, so they felt like they were in the room, and it exposed them to an actual environment of how we do our procedures. But beyond just recording, it turns out that there are many different applications of it. You can actually immerse students in an environment. So now when I give lectures to students, I can actually immerse them into our interventional suites. You can also simulate training. And when you talk about simulating training, you can actually simulate the equipment that we use, simulate the environment that we're in, and then simulate the procedural steps that we do. So I'm going to give you a little showing of how we sort of do this. So on a monthly basis, I give lectures to the Harvard medical students who rotate through us in radiology. And when I do that, I actually have each of the students pull out their own smartphones, and we attach a small viewer, just like this, to their phones. And then I have them scan the QR code that you see there. And when they do that, they're then transported to one of our interventional suites. And so the typical lecture is something like this, where I present a little bit of a history of a patient. I show an imaging. I then have them scan the QR code, and then they're transported. And so this is a video recording of what that would look like. So they can then look around the room, and they can see our interventional suite, and they can see all the equipment that we use there. And I quiz them about what we see there. I ask them about the CT scanner and how we use it in IR, and the risks and benefits of using a CT. I ask them about the ultrasound machine that they see there, and the risks and benefits of using ultrasound for procedures. And so it's very difficult in this day and age to take students out to a location and deposit them there, and then have them work there or see things there while we are providing clinical care to a patient. So this is one way where you can take a student and actually immerse them in the environment. The other way the technology has been used in teaching is using augmented reality. And this is work by the guys at Case Western Reserve University, where they've developed an entire whole anatomy course. They've essentially eliminated their true dissection anatomy course, and with collaboration with Microsoft, they developed an entire whole anatomy software. And this is exactly, this is not a simulated view. This is exactly what the product looks like, where you can see a beating heart and you can walk into it, and you can walk around it. We now have these whole lenses at our lab, and we're now testing them for its use in training residents and fellows in our hospital. So when you talk about simulated training, you have to actually first start off with the equipment that we use in IR. So I found this software called QClone that allowed me to scan in. So if you wanted to use equipment in the virtual environment, the first thing you need to do is to make it all digital. So this was a very simple smartphone software that you could download. You could then walk around any device you wanted to scan into the digital world. You can see by me walking around it, I'm subtracting out that green geodisc that you see. And then once I do a complete walk around this device, I then create a 3D model of it here. So in a second here, you will now start to see a 3D model of this device. And here it is, it's being constructed here. And this is what it looks like when it's complete. And so now when you're trying to simulate procedures, you want people to be exposed to the equipment that we use. So we're now able to take all the equipment that we have, scan it into the HoloLens environment, into a simulated environment, and then have it available. And here is a picture of the real device to the left and the simulated scanned-in device on the right. And the scanned-in device almost looks more realistic than the actual real one. And you can put in different positions. So we went through and we scanned in all of our equipment, all of our blades, all of our stuff, and we eventually created a small collection of virtual devices that we use for our procedures. And really the question then becomes, well, how do you apply this in a simulated world, And in slides, in a few minutes, I'm going to show you how people are able to combine sort of a real mannequin with a simulated devices and be in an environment where they feel everything is real, and you can feel things and touch things, but you can also work with devices that appear real. So this is actually one of the commercially available tools that allow you to do this, where you can actually take this device is available at Amazon for about $20. You can buy this little square device. It allows you to actually hold onto devices. So overlaid onto this device, as I'm looking at it through my smartphone, I can see a beating heart. And so you can see something like this, where an individual can hold on to things, can turn it around, can see three-dimensional relationships between structure, becomes very useful and important. Other individuals have seen the value in terms of combining both simulation and real mannequins. So this is the Canadian Aviation Electronics Healthcare, and they have now been training their OB residents with OB deliveries. Here, there's a mannequin, pregnant mannequin. What the students are seeing is a baby moving around the abdomen, the belly, but they're interacting with an actual mannequin. So both the tactile feel and the simulated environment are both there. And that's what makes this realistic in terms of training. The next thing, other than the equipment and the things that we do, is to actually immerse the individual in the environment. And so we, as I said, have started recording a lot of our procedures. We've recorded both stereoscopic and 360. So this is a 360 recording of one of our ablations. So we had a camera in our IR suite. The camera recorded in 360. And this was me viewing it later using the glasses to look around the room. So the advantage of something like this is that one can be immersed in a situation, in an environment. They can look around the room. If something is going wrong, they can see how the nurse is reacting, how the staff is reacting. And so we see great value in this, especially in terms of ACLS and BLS training, but even in terms of complex cases such as this, where we're doing an ablation. And we're not the only ones that have seen the value of this. At our Society of Interventional Radiology meeting in 2018, the editor of the JVIR, Dr. Ziv Haskell, passed out these lenses, and he allowed individuals to be immersed in his procedure. So here's Dr. Ziv Haskell doing TIPS procedure, one of the more complex interventional radiology procedures. A lot of trainees want to know how the experts in the world do this, so they can actually download the video, put it on the glasses given to them by Dr. Haskell, and be immersed in the environment and look around and see what they need to see in 360. So not only have educators seen the value of this, vendors have also seen value in this. So nowadays, when you go to a lot of medical meetings, when we were going to meetings back in the day, you would see these types of displays where individuals would put Oculus on and they would interact with the equipment that's being advertised and sold. So here is someone learning how to use equipment to do a vertebroplasty. And this was video sent to me by Medtronic showing how they had created an environment where someone can be taught how to do a vertebroplasty. So you can see the simulated patient, the equipment that's there. They would select the appropriate equipment, they would grab it, they would then put it on the patient, and you could see, and this could be used in terms of training if the wrong equipment was chosen, if the position of the equipment was incorrectly placed. All these can be identified and corrected prior to someone practicing on a real patient. So when we were testing this, we were excited, but then the question became, is full immersion absolutely needed? When you're training someone and they just want to know the critical steps of a procedure, do you really need to immerse them in the entire environment? Do they actually need to look around the room and see the whole thing? And I would argue that maybe not. And so this was an application that's available on the App Store from Touch Surgery that gave you just the critical steps that you needed to do, for example, here, a paracentesis. So when you're doing a para, you don't need to be immersed in the room of a para, but you do need to know step by step, what are the things that I need to do a para? And so this is a more simplistic simulated training of showing exactly what one needs to do a procedure. So maybe you don't need to be completely immersed in an environment, but certainly having something like this where it's portable, where you can learn from it at any point, can be very useful. So I have spent the first few minutes talking about VR and AR for education, but now I'm going to sort of transition to its use in clinical care. And when you talk about clinical care, it's not really just procedures, it's also clinic. And so the way we currently, a lot of us do clinic is we sit in a clinic room like this, we talk to a patient, and then we talk to them about their imaging on a 2D monitor here, as you see. But why not do something like this, where you can actually immerse them in the environment of where they're going to have their procedure, where you can immerse them and they can see the actual steps of the procedure. So this is a simulation with two of our clinic employees who could see we had recorded a medical procedure, and they can view it in stereoscopic 360 view to see how is the procedure like. And there have been a lot of studies that have now shown that exposing patients to the environment that they're going to be going in for their procedures, exposing them to the steps of the procedure what they're going to undergo helps reduce the anxiety rates for them for their procedure. So here in this particular case, we were showing the patient how their liver ablation would be done and how the trajectory from the skin to the liver would look like and what the tumors look like in relationship to their livers. So for us in radiology, we're so used to looking at things in 2 dimensions in coronal and sagittal and axial planes. But for a patient, for a surgeon, it's sometimes useful to see things in 3D and see the relationship of vessels to other structures. The other thing was to actually, as I said, immerse people in the environment to their procedure. So we actually started going around and recording the perspective of a patient as they're laying on a CT table for a CT guided procedure. So here we are laying on the CT table. If the patient were to look around the room, this is what they would see. And then as they are being scanned, when they go into the gantry of the CT scanner, this is what they would experience. So again, prior to being exposed to the actual diagnostic study or the procedure, you could now actually immerse the patient in the experience so they know what to expect. And Eleni, who introduced me at the beginning, has been very instrumental in this. The whole reason this whole lab started was that she saw massive potential for this in the patient realm, to educate patients, to be able to go around the entire hospital, video record all the different procedural areas, all the different check-in areas, and give a patient almost a virtual experience of what to expect when you come to Mass General and you undergo a certain type of procedure. So she developed this little doll called Celine that was really a 360 camera loaded onto this thing, and it could walk around. You could move it around as a patient. You could lay it on tables as though a patient were laying, and you could essentially replicate what a patient would experience by doing this. The second use of this clinically is for consultations, and there have been companies that have been exploring this, and we have some of these devices in our lab now. You know, in the olden days of radiology, there was a lot of interaction between the clinician and the radiologist because they had to come down, they had to look at the physical film. In the days of PACS, unfortunately, I feel that we've lost out on that. The ability to, the need to communicate isn't there anymore because a medical doctor could be up on their floor reviewing their images. They can read the report. They can all use PACS to do that. But nowadays, with something like this, both the radiologist and the medical doctor, the surgeon, can be in the same room, and they can be in the same virtual environment. They can see the same images. As someone scrolls through the image, both 1 or 2 or 10 individuals can see the same images. As things are pointed out with the yellow pointer there, everyone can see the same pointer. So if somebody had a question, they can point to it, and someone 1,000 miles away can see the same thing and respond to that query. So again, it's the reimagination of the reading room, the ability to now do a virtual reading room where individuals from all over the world can be in the same space, in the same virtual space, seeing the same digital images and interacting about the same anatomy and pathology. And what I've shown you here is really just cross-sectional imaging. We've actually envisioned where a reading room can include 3-dimensional imaging. You know, maybe you could have any number of windows that shows coronal, sagittal, 3D, all at the same time. So even for a radiologist, and I know Dr. Pomerantz and I always talked about having a virtual reading room where the ability of radiologists is expanded by being able to see all images at once and being able to look around the room. Right now on a PACS workstation, you're limited to 2 screens, and it has one screen for the current and the old screen for the prior. And so having an infinite number of screens does increase our potential to do stuff. And then finally, for me, the particular interest is the application of this stuff for doing procedures, you know, and one of the leaders in this field has been Philips Healthcare. They actually have a lab out here in Cambridge. They have really been exploring the application of augmented reality to aid during procedures. And so you can see here, an interventional radiologist is wearing a headset. He's able to drag the labs, so the vitals of the patient, the imaging of the patient can all be displayed in the procedural suite as they're doing the procedures. So for those of you that have seen IR procedures, you know, right now it's a limited factor. I do a procedure, I step out of the room, I come back into the room. There's a constant back and forth that goes on. With something like this, you don't have to leave the room. You're wearing the lenses, you're seeing things real time. one of the aspects of this that actually helps quite a bit is the verbal interaction. So you can, the proceduralist can ask verbally, show me the vitals, show me the next run, and standing there, it's immediately pulled up and they can go through it. So certainly increases the efficiency of doing procedures, because now you're just interacting with your lens verbally and getting the information you need to do the procedure. And then really the holy grail in terms of combining interventional radiology and augmented reality is the ability to overlay. And so this is another company called NovaRad that has been working very hard in terms of taking MR, CT images of a patient and then overlaying it onto the patient, as you see here. And so the advantage of something like this is that you can now modify the way the procedure is done. Again, Dr. Pomerantz and I had talked a lot about, should these lumbar punctures be done in fluoroscopy? Should they be done portably? But when you do something like this, you can actually do it portably with the assistance of augmented reality to help you. So you're no longer using radiation. You're no longer bringing the patient down, having the logistics of bringing the patient down to do a procedure. You can use augmented reality to help you do the procedure portably, as long as the co-registration, what I mean by that is that the images are in the appropriate plane and linked to the patient are correct. And that certainly is a slight ask. It's one of the challenges. In cases of neurosurgery and in cases of spine surgery where these structures don't move as much, it is much easier to do to co-register and link stuff. In areas where I'm interested in terms of liver biopsies and liver ablations, it could be more challenging because of breathing motion and patient motion. But it turns out that there are individuals that have worked on this. So the first augmented reality for thermal ablations has already been done. I regret that it wasn't here at Mass General, but out in France. And so these guys, Luigi Solviati and his group, used these almost QR codes that they laid on the patient. They then overlaid the anatomy onto the patient. The QR codes allowed one to detect that there was movement of the patient. So any breathing or motion of the patient was then reflected in the change in the position of the QR code, and therefore anatomically things co-registered and re-registered again. And so they were able to do a very challenging case, to be able to use augmented reality and advance a needle into the liver to do an ablation is challenging, but now people are doing this. And I think in the next 5 years, you will see the application of this for surgery, for interventional radiology, and for other parts of medicine. So next question is, where do we go from here? It's all exciting stuff. This all started off sort of in the gaming entertainment industry, and now it's in medicine. And all of us here as panelists are now excited about applying this in medicine, all kinds of medicine. And so there are other companies. So this is another company that we've been working with called Varjo that is now looking at combining the environment that you're in along with these glasses. And in the whole spectrum of reality, there's something called virtual reality with pass-through, where you are actually immersed in an environment, but it's able to identify and record individuals walking into your environment. So something like this, where an individual walks into the environment, so the entire environment is simulated, but the individual that's standing there is real. So the ability to combine degrees of reality versus virtuality is now possible with devices like this. They have now taken the same thing to show how it can be used for medical training. So here, I talked about sort of ACLS, and so here is ACLS. They're in a green room where in a green room, they're able to interact with the mannequin, but they can see everything else is simulated. All the equipment that they see there is simulated. And so it makes it a very realistic scenario to be able to do ACLS training. They've taken it one step further, and this is another video that I'm going to show. It's a little bit graphical here, but it's for EMS training that shows how this can be used to train individuals. So here on the left, you see the person wearing their glass looking around just a regular room. But in what you see on your right is the glasses, what they're seeing through their glasses. And so here now you're going to combine the mannequin and the real environment. And so here we go. So now they're suddenly in an environment. There's been a car accident. There's a guy there with his foot chopped off, and they're asked to quickly identify what's going on and act on it. So I mean, this is ACLS 3.0. It's simulation at its greatest, where you are now asked to be immersed in an environment. It looks so realistic. and you're asked to act very quickly. And so instead of working and practicing on real patients, you now go through a simulator like this, and you experience everything as though it's real. And then this is one of their other products that they've been doing, where it allows individuals from all over the world to interact together. So here are different surgeons from different parts of the world, all sort of collaborating and interacting for a case. And they're able to sort of ask each other questions and collaborate on a case to do a case together. So finally, I'm going to spend just a few moments talking about our exciting ARVR Lab. We're excited about this. I think we have a whole bunch of guys here that you'll meet in a few minutes that are very excited about this. The real purpose of this lab is really to help with trainee education, patient education, and then clinical learning, for both IR, for diagnostic, and really for medicine. We have talked to the guys at the Martino Center who also are very interested in this technology. There are other departments, particularly the Department of Neurosurgery here at MGH, that has been interested in this thing, and even other hospitals that have come to us and have heard about what we're doing and want to work with us in this lab with the resources that we have. Just to give you a location, we are located behind MGH. This is Blossom Street. On the right is the main MGH building. On the left is the Immersion building, and on the basement of that is the 2 Immersion Place, which is where our lab is located. We have augmented reality glasses, the HoloLens 1 and 2. We have virtual reality glasses, the Oculus, and Luxonic, which is the virtual radiology reading room. We've been working with a bunch of collaborators, and we've even started defining our own green room to be able to do some of the high-end stuff that you saw on the Varjo videos. This is sort of a close-up view of where we're at. This is an image of our green room. And then before I end, this is not just, it takes a village to build this, and we're very excited that we have a good group of people, Eleni Min, who's one of our residents here, Stuart, who you'll also hear about, he's one of our neuroradiologists, Gianluca, who has been running a simulation lab for many years out at Cambridge, and then Noam and Jess, who are part of the Martino Center, who we're very happy to work with. And ultimately, before I end, I do want to thank Dr. Brink. We had invited Dr. Brink down, our chairman of our department, to see our lab. I don't think he was aware all the stuff that he'd been doing. And he was really, I think, maybe I'm speaking too frankly, he was blown away by some of the stuff that we were doing, and he was excited. So we're very happy to have his support for this stuff. This is, some of Min's work, which I think he'll show in a second. So I'm not going to go through it, but he's now started bringing medical students down and introducing them to the HoloLens. I'm going to just skip that because I think he's going to go through it. But in conclusion, we're lucky in radiology because we're based on digitized information. And so our ability to use this for VR and AR and adopt it for us is very easy. And we're very excited to be able to do that. As I've shown you, I hope you understand that this will have an impact on training. I think the ability to do very realistic simulations, especially in a green room where you can create an entire environment, is now probably possible. In the next 1 or 2 years, we'll have it all down. I think it could really simulate training. And certainly my personal goal is to help improve the clinical care. Can you now do procedures with less radiation, with more efficiency in IR, in surgery? And then finally, I do want to say that our lab can serve as a resource. We want people to come to see us. We want people to come visit us. We're happy to set up sort of appointment times for you guys to come visit us and see what we do. We want people to learn and grow from this. So we're very happy to see what projects, what ideas you guys have, and we're happy to help you with those ideas. So I want to thank you here, and I'm going to end here. And I think Eleni's going to take over. Thank you very much.
Sure. Thank you, Dr. Upper, for a fantastic overview on AR and VR. Right now, we'll switch over to, I will take over the screen, to our next presenter, which will be Dr. Lang. He is also a co-founder of our lab, and he's a resident and recently came here from Case Western, where he studied AR and VR as relating to cadaveric dissection. He brings an extensive amount of experience with him. So Dr. Lang, take it away.
Thank you, Lenny. Thank you so much for the introduction. Yeah, I really appreciate this opportunity to demonstrate what our lab is currently doing for medical education. With the support of Dr. Avery, who is the clerkship director of MGH radiology rotation for Harvard medical students, we were able to bring medical students rotating through the radiology clerkship to our lab to test out the AR and VR technology. So here are some photos that we took during some of those sessions. One cool thing about this technology is that all of us wearing these headsets, we're all looking at the exact same augmented reality model. And through that, we're able to have an interactive and more collaborative session. And as you can see on the bottom right here, that's actually Dr. Pomerantz coming to our lab testing on the technology as well. Can you go to the next slide? Here are some example videos that the medical students actually took during some of those sessions. As you can see, there's a 3D hologram that is superimposed on real life surroundings. And like I mentioned before, all of us donning the HoloLens are able to visualize and look at the same model at the same time and could have an interactive educational session. So far, the feedback from the students have been very positive. And I think it could be a very useful tool for medical education, but also for clinical practice. And just a disclaimer, the resolution of the images that you see here is not as good as what you would actually see in the HoloLens in real life. The resolution in real life is much better than what is shown here. Finally, education is just one part of what our lab is trying to achieve. And we really welcome everyone who's interested in AR and VR technology to come to visit our lab and to really experience the technology yourself. And if you have any ideas in terms of research or clinical use for AR or VR, please reach out to us, and we're more than happy to provide you with whatever resources that we have. Thank you.
Great, thank you, Dr. Lang. Next is Jess Gerber, who is with the Martino Center and works with MGH Clinical Translational Research Unit.
Thanks, Eleni. Hi, everyone. Yeah, I'm the program manager for the Interdisciplinary Brain Center, which is a group of collaborators from neurology, psychiatry, and radiology, specifically the Martino Center, and also I3, which is the Institution for Innovation in Imaging. And basically, we're developing a core over in Charlestown Navy Yard. And this is going to be a true clinical translational research unit. And so our focus with this is more research than actual clinical applications. And so we were very fortunate to receive a Massachusetts Life Sciences Competitive Capital Award. And the basis for that award was we're building a data visualization room. So we're still under construction, but our data visualization room is going to have a 9-panel hyperwall, a virtual reality cave. We'll have HoloLens, which Dr. Paulet's going to speak to. But what's really, I think, unique and interesting for anybody is that we're going to have the virtual reality cave for development up on the 10th floor of 149, but then on the 2nd floor, this is also under construction, we're going to have a virtual reality cave for participants, research participants. And what's even more novel and exciting is we are linking physiological monitoring systems like the BioPack. I'm not sure if folks are familiar with that, but we'll be able to do dynamometer, we'll be able to do heart rate, eye tracking in the virtual reality environment. And we're trying to have these be outcomes. These are going to be measures that we would, have participants, to measure participants that are going through studies. So for example, we might have, the possibilities are endless. And so this is sort of just a shameless plug to say, come check out our center and all these capabilities. But, for example, we could have someone with cognitive issues, cognitive impairment. We could give them money and put them in a grocery store and say, go through the grocery store and tell us what you might pick out for dinner, and see how they do, things like that. And then, as we give them different interventions and different therapeutics, see, do they change over time? Are they able to function more clearly? We could also, right now, one of the a very common test is you give someone a picture of their family and you track their eyes as they go through the photo to recognize their their loved ones in the photo. Well, instead of doing a photo, we might be able to put them in an environment, put them actually at a party or at a wedding, and see how they do, interacting with people that they know. So, like I said, the possibilities are endless. We're really excited for this, and yeah, please feel free to reach out.
Great, thank you, Jess. We're very excited to collaborate with you. Next is Noam Peled, as Jess mentioned, is a part of the Martino Center as well, and a research scientist.
Okay, hi. So today I want mainly to talk about a company that Steven Stafferbeam, the medical director of the Martinos, and I opened 2 years ago around a product that we developed together during my postdoc. And it was mostly about neurosurgical planning. So next, please. The idea was about to integrate multimodal data sets. If it's non-invasive data sets like EEG, MGH, MRI, and PET, or also invasive electrodes. And we realized 2 years ago that a very nice application for that can be neurosurgical planning. Right now it runs over Blender, and now we're also working on a version that will run over web and also on the augmented reality and virtual reality, as you can see here. Next, please. And what are we planning to do with it? So right now, as I mentioned, we're going on the planning, but next we also want to use it for training and also to take all this rich information into the operation room and project it on the patient. Next, please. So here's how we're going to do it for the surgical planning. So in the middle, you can see a hologram using HoloLens, and you can operate this hologram using the HoloLens or multiple HoloLens that are synced together, and also with the web platform that you can also kind of synchronize and activate everything. And we are collaborating with a company right now that use webcams to detect real objects in space and interact on the holograms, like the scalpel here. So the surgeons will be able to use real surgical tools and interact over the hologram. Next, please. And next in the wow, we want to do something like a navigation system. So we have the technology to detect fascial points like in the upper left image. And you can see a real scalpel. So we can now co-register the patient's MRI space to an MRI space, as you can see in the right, and mimic the same surgical tool. So now you can project all the non-invasive data set and even the invasive data sets during the surgery. Next, please. And about training, now the trainees will be able to download from our server real cases and see what the neurosurgeon was doing and what were the decisions that are taking, and try to do the same thing, while the tutor can interactively and synchronize in their session even remotely. Next. So as just mentioned, I'm also part of the visualization room. Here you can see the HoloLens, Oculus, and also Haptic Lab. And we want to connect them together. So for example, the Haptic Lab can help us to determine better where the fingers are. So now you can even with your fingers do a surgery or simulate a surgery on a hologram. Next. So this is our app for hologram. Now for HoloLens, you can see here the MRI slice of a real patient that was reconstructed from the diaphragms. We use FreeSurfer from the Martinos to reconstruct the PL surface. And you can interact, so you can remove the hemisphere. You can see the dots, which are the SIG electrodes. Now we can return it. And in the future, we want to include all the other types of information, like the colors here are the MEG data that we snap on the surface. And these are all the links for more information about it. I think Elena can pass it forward after that. Thanks so much. And this is me with my half brain generated using our tool.
Thank you very much. That was great. Next up is Dr. Stuart Pomerantz, who is a neuro Radiologist with IT experience in workflow, efficiency, and radiology systems integration, now focusing on AI development at CCDS with a great interest in ARVR.
Thank you for the introduction and the rest of the ARVR Lab for setting it up, founding it, and allowing me to become a part of it. It's very exciting, and it's also exciting to hear what the wider community that we'll hopefully be collaborating with is doing. I'll address some interesting AR and VR projects that I've been working on and in collaboration with the lab. My MO is a clinician, developer, very interested in improving the efficiency of workflow, is to look at what's clinically commercially available and see how that can be integrated into pre-existing systems that we already have in place in our workflow through a little bit of glueware, APIs and so forth, and even screen hacking to basically have fast translation of this new technology, particularly that's coming very fast in the consumer realm, and make it a reality for us in our radiology workflow. What I initially, when I first got my VR headset for under $300, which is the Oculus Quest 2, I sought to understand how we could reproduce our actual working practical PACS radiology workflow in VR. And so one of my favorite movies is The Matrix, and I'm sure everyone here has seen it, and there's a scene where Neo says, "We need guns, lots of guns." And at that point, racks and racks, hundreds of racks of guns come into this white open, virtual space. Well, for radiologists, it's not guns, but monitors. We want lots and lots of monitors to surround us, and around it, 360 degree, and have all our priors and all our multi-series comparisons and 40-time comparisons. And then also have space for the EHR, or voice dictation, all the other websites that we use and reference. And then now Zoom and Teams and other collaborative and consultative functions that we also do. We just need more monitor space. Well, there are software that's available, commercially available, that works with the Oculus Quest and other VR headsets. One of them is a remote desktop, and actually now in the latest update to the actual Oculus Quest native software, they also have a direct remote desktop, so you don't have to pay extra for this. And if you can bring up PACS, as we can on our laptops, either through downloading our real PACS software or through a Citrix environment, you can have the PACS environment on as big a screen as you want with a VR. But this is just kind of one screen, one monitor. I was doing it off of a laptop. And then if we do it off a computer that has just a couple more monitors, then that doesn't really change too much of what we're doing. So what we really want is more monitors. So if we go to the next slide, there's another software. And again, it bounces around a little bit. That's me looking to the right and left in the camera view. In the actual, if you had the headset on, it would be just naturally you just looking to the right and left in this big environment you're in. So here, there's this work zone, and this is a software called vSpatial, and it's looking at all the windows I have, open windows that are my taskbar of my laptop, and it's creating a curved workspace. And I can just create more and more windows. There are thumbnails at the top, there's intermediate sized thumbnails, and I can just keep on grabbing more and more windows, more and more software, if you can see. And there's controls to slide. I could go around and spin around in my chair. It goes up and down as well. And it's pretty amazing. And then not only imaging, but you'll see I bring up the dictation software here. And then I think also, again, all the normal PACS functionality, because this is the PACS software. And then finally, I think there's the paging system. So again, we can basically have, just like Neo and Trinity, we can have as many guns and monitors as we want to do our job. And again, it's not just PACS, it's all the other pieces of the radiology workstation environment. You might say, to be practical, you still need a mouse and a keyboard and not tapping in the air. And that's very true, even though voice recognition has gotten so well. The exciting thing is that the hardware has 4 inbuilt cameras, so that it's not only virtual reality. It's also mixed reality with augmented features. So there's newer software updates where it can register a keyboard and a mouse that's on your desktop. And so your hand and the virtual hands that you'll see are resting on a real keyboard on your desktop, a real mouse. So you can have all the efficiencies of typing and using a mouse, and you don't have to just like click around with the hand environments. So very exciting. Move on to the next slide. We'll spend a lot of time talking about augmented reality for interventional procedures, and mention spine as well, and how it can benefit radiologists or patients. What I'm really hoping with this AR software is to enable clinicians who do bedside procedures of lumbar puncture without imaging to take some of the same approaches that we do in radiology with imaging that they normally wouldn't be able to do just by palpable landmarks. And again, we can extend on this for subsequent talks, but if you you can't, normally they would just do midline approach at L4-5 level, and that doesn't work when there's a lot of degenerative disease. And so if you go to the next slide, this is where they might normally put the needle in the green, but it's kind of you know, very, very tight. And that's why might be why someone might fail at the bedside. But we have imaging, and we can do an oblique interlaminar approach, which could sometimes involve a lot of tilting, but it opens our space up, and we just go down this oblique approach. It's easy. How can we allow the clinicians to do that bedside? So go to the next slide. This is where something like augmented reality, we can superimpose those views. What this actually shows is why the clinicians can't do this on their own. This oblique interlaminar approach sometimes results in like 5 or 6 or more centimeters to one side or the other, and caudally or cranially. And this is just not a place where a clinician would feel to go on a long pathway, but we can do it under imaging. So if you go to the next slide, we can have them have comfort with that using the NovaRad or other AR systems to plot that, superimpose a CT, which the patients very often have, and superimpose that on the skin of their patient using various landmark systems, which different people have shown earlier, and then open up that oblique interlaminar approach to bedside radiologists. And just like you know, in the ICU, no one would put a central line or an arterial line in the subclavian without just by palpable landmarks like I did when I was in medical school. Now they use ultrasound. I want it to be, the future would be no one would do a lumbar puncture bedside without some augmented reality to make it more successful and a better experience for the patient.
Fantastic. Thank you, Dr. Pomerantz. Last and certainly not least is Gianluca De Novi. He's the director of the Medical Device and Simulation Lab at MGH, instructor of radiology at Harvard Medical School, and instructor of VR, AR, MR at Harvard Extension School.
Hi, thank you for the introduction. Well, I've been working on in the field of VR and AR since the late 90s. I've been literally developing 3D engines and physics engines. So one is for the appearance and the other is for the behavior of in the virtual worlds. And during my master's degree and PhD, I've been working on soft tissue simulation for surgery. And that has been pretty much what I've been developing in most of these years. If you could please go on the next slide. This is an example of a laparoscopic or a surgical robot operation. And then there is the possibility of the virtual instruments to interact with the tissues and have the correct mechanical response, not only, but also the haptic feedback. So the possibility to feel on the hands the weight or the stiffness of the different tissues, or the feeling of when you perform a cut or when you punch through some tissue. And I've been also doing these for other kind of surgeries. For example, there is a on the very right of the screen that is an image of a catheter balloon simulator, stent, and for stent implants. So there is like this small device where you stick the catheter and then can exercise some active forces on the catheter. And so we develop at the current laboratory, which I'm directing, in Mass General Medical Device and Simulation Laboratories, the hardware and the software of this kind of simulators. So we work with mostly in the VR, and to be honest, monitor or VR, but recently there is more interest also in the AR, considering that finally some good quality hardware is coming along. If you could please go to the next slide. Yeah, here are some other examples of devices and software developed at our laboratory. On the very right, we can see an augmented reality microscope, which was designed and developed at our laboratory. So, you know, augmented reality, but what if you need it for microscopy? And then, so what we did essentially was to hack an existing microscope and design an add-on to overlap stereoscopic synthetic images to the field of view of the microscope, obviously synchronizing also with the amount of light generated. So I'm making everything looking consistent with the environment. In this small picture next to the microscope, you can see there is that geometrical shape floating on top of whatever is in the background. Plus there is this green ring, which are two ways to create augmentation. One is just projecting information, so like numbers or text, and the other is projecting three-dimensional objects. And then we've been developing XC procedures for fertilizations of egg cells, for example, or we have been doing the same for surgical gesture analysis for ocular and facial trauma simulators. And the picture in the center of the screen essentially is the software developed where there is essentially in the reality, there is a real head of a mannequin, and then there is a simulated head, and then there are instruments that are co-registered between the real world and the artificial world. And then there is software, an AI software that recognizes all the movements and understand what essentially the surgeon is doing, giving scores, and also providing feedbacks in case some of the steps of the procedures were forgotten. And on the very left of the screen, that is the advanced modular mannequin for which we've been working on the initial phase of the development of the project for the DoD, which is also combining some augmented reality features to the real world of the mannequins. And I think there is one last slide. Here there is like another simulator, which it's a mixed reality simulator where essentially there is the possibility, we are teaching how to use a scanner for the ear canal. And there is the possibility to have the tactile feedback on the real mannequin. And then there is the augmented mannequin, so the augmented geometry, which shows essentially what is happening inside, and then the possibility for the user to see from different point of view what is happening. And on the very right of the screen, there is this data glove, which is my first hardware product that I developed and sold on the worldwide market in 2005, which was a data glove. So everybody thinks that virtual reality is a very recent thing. It's actually not, it's pretty old. And I think that's all for now. Thank you.
Thank you very much, Dr. Novi. Thank you to all of our panelists, and a special thank you to Dr. Uppot for presenting today. Please reach out to us if you'd like to hear more about our lab, or to come and see our lab, or to attend a demo. We are in the office Thursdays and Fridays. Drop-in hours are available. If you missed the text, this is the text code for CME credit. We are recording this lecture, and we will post it and disseminate it amongst the department and beyond. If you have any questions for our panelists and for our main presenter, Dr. Uppot, please put that in the Q&A chat. Additionally, you can also chat in your email if you would like to join our listserv. So I'll open up the floor for a minute or two and see if any other questions come in. Okay. All right. Well, feel free to reach out to us at any time. And this was a great presentation. Thank you all.
Thank you. Lenny, thank you for organizing this. Thank you very much. Thanks to all the panelists.
Thank you, everyone.
Thanks so much.
Thanks, everybody.
Yeah.